let's just take a minute and address some of the vaccine-related questions that I think people have. And I want to start with you, Dr. Malone, if that's okay, because you are one of the architects of mRNA technology. And if I were to ask you, Dr. Malone, are you against the vaccine for COVID? I know your answer would be absolutely not, but you do have some issues with this particular vaccine. Why?
So, thanks for that opportunity to make the point that I'm not an anti-vaxxer. I'm a guy who spent the majority of my adult life developing vaccines and trying to get vaccines licensed. For example, the Ebola vaccine that we call the Merck vaccine. This is a technology platform that I believe, and many believe, has enormous promise. And right now, it's in its infancy. The safety of the underlying technology is not yet fully demonstrated. It hasn't been fully characterized, and that will come. That's good news. However, in the fog of war and the need to come up with something as soon as possible, some decisions were made to move things forward very rapidly. They were based on incomplete information. No harm, no foul. People did what they did in good faith and focused on a protein that they thought was fully safe, spike. But now, over a year later, we know that in the virus, this protein is responsible for much of the disease that the virus causes, the pathology in your vascular endothelial cells, the coagulation. And it's unfortunate that this particular protein, in what appears to be a biologically active form, was used in these vaccines.
What is the result of that? What does that mean is happening?
This is a thromboembolic disease. What does that mean? COVID is a clotting disease. COVID is a clotting disease. COVID is a clotting disease. Now, when we give a spike protein, to Dr. Malone's point, that is an active biologic molecule, we chose the wrong molecule that causes disease. So what do I see under the microscope? You see these COVID skin cases, these weird COVID rashes. What is that? That's clotting in the skin. When I get the autopsy tissues now from my colleagues around the country, these patients that, we have, unfortunately, doctors that say there's no damage from the vaccines and no deaths from the vaccines. We should use the French legal system. When we have a new product that's never been used on humanity in the market, it's guilty until proven innocent. Every time there is damage or disease from that product, we need to assume it is until we prove it isn't. So under the microscope, we see clotting in the lungs, we see clotting in the vessels, we see clotting in the brain, not from the virus, but from the spike from the vaccine itself. Now, consider the numerator and the denominator. Are most people going to be fine? Yes, and I want to emphasize that. In our data around the world, from the United States, from the UK, from the Eurovigilance in Europe, we have seen more death and damage from this one medical product than all other vaccines combined in the last several decades, in just a short 8-month window of time. It has done more damage than any other medical product, therapy, shot, modality of anything we've ever allowed to stay on the market to this point. Wow. Do I mean to sound alarmist? No, I'm being factual.
Let's just apply common sense. It normally takes a decade or more to produce a vaccine that is safe and effective and to demonstrate that it's safe. The usual standard with the FDA is that you allow at least 2 years after you have administered the phase 3 material to at least 3,000 people for a vaccine. Often the FDA wants many more people than that. And you follow them for 2 years at least to see whether or not they're generating autoimmune problems, etc. And you're dead on. I mean, any of you can do the math, okay? Have shortcuts been taken? Normally it takes 3 years to evaluate the data. This was deployed in 8 months, 6 months or less after the phase 3 trials were completed. So it doesn't take a genius to figure out the common sense that we don't have the information. In terms of safety in pregnancy, reproductive toxicology, reproductive risks, potential birth defects, the honest truth is, whatever they tell you, we don't have the data. So whomever is speaking, if they're telling you that it's safe, but they haven't actually done the studies, I think you can figure out that that means that they're not being, let's see, gently truthful with you.
Were women even included? Were pregnant women even included in the clinical trials?
Of course they weren't. The NIH just funded the study like a week ago on reproductive toxicology and birth defects in children. The study, the major study on potential risks in pregnancy, wasn't started until after, about almost a month after, the CDC said it's okay to go ahead and start taking the vaccine. Here's what I do know about multiple boosters. The immune system is really, really complex. And it's as complex as the nervous system, which, by the way, comes from the same cell type. Incredibly complex. And one thing, as somebody that's been in this business and had all this stupid training for 30 years, more is not better. The assumption that another dose is going to boost your immunity to levels that it was previously needs to be demonstrated clearly, and the safety of that needs to be demonstrated. Because as immunologists, we know darn well there's a thing called high zone tolerance. More is not better. More can actually suppress the immune response.
After the extra shots, we're seeing the depletion of certain cell types. To your point, we're starting to document it and studying it. And to his question, why give a third shot to a virus that was gone in January and February of this year? We're on to Delta. The booster is not something new. It's the same shot for the virus that's gone. Delta's a new virus, essentially. So is there any logic to boost something that's not even here anymore? No.
So people are, we're vaccinating. By giving that booster shot, we're vaccinating for COVID, and we're already on to Delta and move.
D614G strain that we made the sequence for the spike against isn't even circulating anymore. It's not even here. We're 1, 2, 3, 4, 5 variants on from that. Delta is behaving as a new virus. The antibodies don't neutralize it anymore, especially the N-terminal domain of the spike. It's a wrong approach at this point. It is the wrong protein now. It's not even a virus that's here.